Due to the ongoing spread of COVID-19, the masses have been discouraged from leaving their homes. Countries all over the world have implemented nationwide lockdowns in an attempt of flattening the curve.
The Philippines has implemented said lockdown in March 2020. However, over time, public officials have gradually become less strict, now allowing citizens outside despite seeing no improvement in COVID-19 cases.
In the face of the new normal, the government has provided us with alternative means in order to minimize social gatherings. Schools have shifted to online classes, celebrations are now held via Facebook Live, and public places such as malls have been keen on the social distancing rule.
According to Katie Pierce, social distancing is a public health practice that aims to prevent sick people from coming in close contact with healthy people in order to reduce opportunities for disease transmission. It can include large-scale measures like canceling group events or closing public spaces, as well as individual decisions such as avoiding crowds.
However, with the added practices of wearing face masks, face shields, and bringing alcohol, we might find ourselves wondering, is social distancing really necessary? According to the Centers for Disease Control and Prevention, COVID-19 can live for hours or days in a surface, depending on factors such as sunlight, humidity, and the type of surface. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or eyes. However, this is not thought to be the main way the virus spreads. Social distancing helps limit opportunities to come in contact with contaminated surfaces and infected people outside the home.
Physical distancing is not only beneficial to us but to the community as a whole. The act of minimizing close contact with other people prevents us from getting infected, as well as spreading the virus to others.
It is a collective effort of flattening the curve and lessening the events of overcrowding in health centers. Social distancing lessens the burden placed on our frontliners.
These are the guidelines for proper social distancing provided by cdc.gov.
Know before you go. Before going out, know and follow the guidance from local public health authorities where you live.
Prepare for transportation. Consider social distancing options to travel safely when running errands or commuting to and from work. When using public transportation, make sure to maintain a distance of at least 6 feet from other passengers. Disinfect the areas where you sit and touch.
Limit contact. Only visit stores selling household essentials in person when you absolutely need to, and stay at least 6 feet away from others who are not from your household. If possible, use drive-thru, curbside pickup, or delivery services to limit face-to-face contact with others. Maintain physical distance between yourself and delivery service providers during exchanges and wear a mask.
Keep distance at events and gatherings. It is safest to avoid crowded places and gatherings where it may be difficult to stay at least 6 feet away from others who are not from your household. If you are in a crowded space, try to keep 6 feet of space between yourself and others at all times and wear a mask.
And lastly, know the purpose. Before you step outside, be 100% sure that your purpose is necessary and urgent.
Enough about the upsides of social distancing. What are the consequences of not following the proper guidelines?
Something as simple as an individual not following proper physical distancing can lead to bigger problems.
COVID-19 cases can worsen, healthcare facilities can decline, and deaths are likely to rise along with infection cases. When the virus can no longer be contained, the government can implement another nationwide lockdown, and all progress will be for nothing.
Community lockdowns can affect public services, workplaces, and even education. Loss of work can lead to the rise of unemployment, and our economy suffers more than it already has in the past.
Maybe instead of complaining about the boredom of staying at home, we can actually maximize our time and do something more productive.
Another article from cdc.gov recommends ideas on being physically and mentally active while also following the standard health precautions such as
engaging in family bonding,
starting new hobbies such as gardening,
catching up on household chores,
trying out new meal recipes,
And probably the most important, staying informed on the relevant news about our country amidst the pandemic.
The battle between the nation and the virus is far greater than our unnecessary outings and gatherings.
So always remember to stay healthy, socially distanced, and most importantly, stay safe.